Are you in your first trimester of pregnancy and are dealing with some symptoms that have you worried? I have some information that may help put some of that worry to rest. Hello learners, and welcome back to Nurse Onyi Teaches. My name is Onyi, and today I will be covering common symptoms that many women deal with during their first trimester of pregnancy. Symptom number 1, nausea and vomiting, famously known as morning sickness. If you are among an unfortunate few, you know that morning sickness can last all day. An approximate 75% of all pregnant women deal with some degree of nausea and vomiting. There is good news. Morning sickness or nausea and vomiting start to go away toward the end of your first trimester. There are some things that you can do to help relieve the sensation of throwing up. Number 1, eat smaller meals and eat more frequently during the day. By doing this, you provide your body with a ready store of fuel so that your blood sugar levels does not crash. When blood sugar crashes, your body tends to pitch a fit and causes you to feel the urge to throw up. You can also prepare for the next morning by placing a small snack, usually something bland, by the side of your bed. And when you wake up in the morning before you get up to do your activities, eat this small snack. What that does is absorb the stomach acids that have collected overnight as you slept. And then when you get up, that churn of acid does not cause you to feel that instant urge to hurl. You should also avoid spicy foods. Spicy foods tend to increase the likelihood that you will be nauseated and throw up. On the far end of nausea and vomiting is something known as hyperemesis gravidarum. This is not the same as nausea and vomiting that affects all walks of life. This is a more serious condition where it is difficult for you to keep food and water down. It can lead to weight loss, it can lead to dehydration, and it can cause some more very adverse responses in your body. If you experience vomiting that you cannot seem to stop, you need to get in touch with your healthcare provider. You may need to be seen in the hospital. If you get to the point where you are throwing up blood, go straight to the emergency room if there is one in your area and get seen. You may need IV fluids to rehydrate you. Hyperemesis gravidarum is not normal, and I need to stress that here because I don't want a woman to think, oh, I'm throwing up, this should be normal. It is not normal to be incapable of eating and drinking during the day. Symptom number 2, increased urinating. An overwhelming number of women deal with an increased urge to use the bathroom, to pee, during the first trimester of pregnancy. This is because as your uterus grows, it puts pressure on your bladder. If you look at this image here, you can see that the bladder is right next to the uterus, and growth in the uterus causes stimulation of the bladder. And every time the bladder is stimulated, because it's a muscle, it's going to respond by contracting, which makes you feel like you've got to go urinate. Unfortunately, you still have to drink water. The more you pee, you have to replace it. But remember, this too will start to reduce in frequency as you transition into your second trimester, so don't be too alarmed. Symptom number 3, breast enlargement, tingling, and tenderness. A lot of women will let you know that right before their cycle, they deal with these same symptoms. The hormones that influence it during your cycle are also in play during the first trimester in pregnancy. Your body is preparing you to nurture and nurse a baby at the end of the pregnancy. So these hormones are causing these changes in your body. Rest assured that this tenderness will not last throughout the pregnancy, and it also, like the other previous symptoms, begins to go away as you transition out of your first trimester. Symptom number 4, and a lot of women deal with this. Almost 95% of women deal with an increase in sleepiness. A lot of women get fatigued easily. It's because your body is consuming a high amount of energy to create this new life in you. If you are not able to commit hours to sleeping, take a power nap. 10 minutes here and there can rejuvenate and invigorate your body and give you enough energy to continue your activities. Symptom number 5, heartburn. Heartburn is a result of your body releasing hormones that slows down your digestive tract in order for food to pass through slowly. The slower food passes through, the better your body is able to pull important nutrients out of it to take care of your body and your baby's body. Now, there are certain things that you can do to alleviate or relieve the feeling of heartburn. As previously mentioned, eat smaller meals. If you eat a heavy meal, it takes your body longer to process it. And food just sitting around in your stomach with gases swirling around in it will cause you to belch, will cause that to come shooting back up your esophagus, and it will burn. The smaller your meal intake is, the faster your body can get it into your intestines and out of your stomach. Drink more water. Water can help to soothe your esophageal lining, which is your throat, and calm down that acid that wants to churn up too frequently. Symptom number 6, constipation. Like heartburn, constipation is also caused by the hormone called progesterone. When your digestive tract slows down, it causes stool or bowel movement or poop, whatever you want to call it, to sit for longer periods in your intestinal tract. The longer poop sits, the more water is drawn out of it. If you didn't know, the one job your large intestine does very well is pull water out of your waste products so that you can stay hydrated. Unfortunately, the more water that gets pulled out of your waste product from eating, the more condensed and heavier and harder to push out your bowel movements are. What you can do to alleviate constipation is eat a diet that is rich in fiber. Oatmeal is a good example. You can increase your water intake. You can also increase the amount of fruits and vegetables that you eat. And most of all, stay active. The more you move, the more the activity of your intestines, and that will encourage your body to have a bowel movement. Last but not least, sciatic nerve pain. As your uterus grows and moves upward into your abdomen, it crosses paths with these nerves that run through your buttocks down into your legs. These sciatic nerves do not like pressure being applied to them. When your uterus bumps up against them, they hurt. It can send a shooting pain sensation down whatever side of your body where your uterus leans up against that nerve. There's not a lot you can do about sciatic nerve pain. You can move around to move your uterus a little bit. You can also lay on the opposite side of wherever you feel the pain just to cause the uterus to shift away from that nerve. If you found any of this information helpful, go ahead and subscribe. Give me a thumbs up on this video. Do not forget to leave a comment if you have any questions or concerns that you would like to have addressed. And then share this video with somebody who may find value in it. Thank you for watching this and come along with me as we build this community. Until the next time, I wish you a happy, safe, and healthy pregnancy.